As we have discussed previously as a continuation of the topics in the previous episodes, today we are going to discuss about the pathology of the pituitary gland. So as we have discussed previously, pituitary gland is that part of the gland which is bean shaped and present in the sella turcica. So the diseases that affect the pituitary gland aren't due to the abnormalities of the pituitary gland, but rather it is due to the defect of the hypothalamic factors. So there could be hyperpituitarism or hypopituitarism depending on the excess or lack of tropic hormones. What are tropic hormones? Tropic hormones are the hormones that are present which has their target organ as any other endocrine gland. Hyperpituitarism, for that matter, is that kind of disorder in which there is an excessive secretion of the tropic hormones. So, if a person is hypopituitarism affected with the disorder, so if the person is affected by hypopituitarism, it means that is due to the lack of secretion of the tropic hormones or due to any defect like surgical or radiological or ischemic injury to the gland. Depending on the different sizes of adenomas that could be present in the pituitary gland or in the extra pituitary, as an extra pituitary lesion, the pituitary adenomas could be listed as microadenomas and macroadenomas. If the gland is more than 1 centimeter, it is macroadenoma, and if the pituitary adenoma is less than 1 centimeter, it is known as microadenoma. So, as we have already discussed this, depending on the size, there is variation in the names of adenomas. As mass defects, the major kind of defects that occur in the human body due to the adenomas present in, or due to the adenomas or the abnormalities in the sella turcica, is directly affecting the human body. How is it affecting? If there is an erosion or there is a defect in the sella, any other kind of defect in the sella turcica, that could directly or indirectly lead to any other diseases. For example, hyperpituitarism or hyperpituitarism kind of diseases in the human body. But if there is any kind of disorders other than hyper or hyperpituitarism that could be due to any other symptoms, it would be the first and the foremost one that we have to discuss is due to the vision field defect. That is due to the optic chiasm being decussation of the optic chiasm that could result in the visual field defect, that is lateral visual field defect. That is what is caused by the local mass abnormalities. So that are the radiographic abnormalities which we were talking about in the first session, that is radiological abnormalities in the sella turcica. How is it affecting the human body? Okay, so the symptoms of other signs and symptoms could be intracranial pressure, including headache, nausea, vomiting, and all this kind of symptoms. So the other causes, the most common cause of hyperpituitarism is anterior lobe, the adenoma in the anterior lobe. Not only that, there are many other causes as well. The other causes include hyperplasia, secretions, and hypothalamic disorders. Not only that, even many kind of carcinomas of anterior pituitary. So that's what we are discussing in the first episode. Like today, what